Hello, my name is Johnny Pincay Pinargote. I'm a student University Católica Santiago de Guayaquil in Carrec Nurse. Avances Mycosis Fungoides. Okay. Definition. Mycosis fungoides and Sézary syndrome are diseases in which lymphoma and type of white cells become malignant cancers and affect the skin. Mycosis fungoides sensory syndrome are type of cutaneous T cells, lymphoma, and red on the skin is a sign of mycosis fungoides. Application in Ecuador. Application in nurse. Number 1. Radiation therapy with solar and ultraviolet radiation A. Number 2. Ultraviolet radiation therapy. Number 3. Total skin radiation therapy with electron beam. Number 4. Immunotherapy alone on the or in combination with skin directed therapy. Number 5. Topical chemotherapy.
Advanced Mycosis Fungoides.
A 53-year-old man with a history of treated stage 1A mycosis fungoides that had been diagnosed 7 years earlier, presented with a 2-month history of new and rapidly progressing lesions on his face and body. Examination of the head and neck showed multiple coalescing subcutaneous nodular lesions and deep furrowing of skin folds that resulted in distortion of the patient's facial features, panel A. Also present were numerous hyperpigmented erythematous nodules, as well as crusted hyperkeratotic tumors, affecting approximately 85% of the patient's total body surface area. Flow cytometry of the peripheral blood identified a small population of atypical lymphocytes, and positron emission tomography showed increased fluorodeoxycholic uptake in the cervical, axillary, and pelvic lymph nodes, as well as in the spleen and liver. A skin biopsy confirmed the diagnosis of mycosis fungoides, with CD30 expressing large cell transformation. The patient began a regimen of brentuximab, cyclophosphamide, doxorubicin, and prednisone, and notable improvement was seen after 2 cycles, panel B.
What causes mycosis fungoides?
The cause of mycosis fungoides is unknown. Most affected individuals have one or more chromosomal abnormalities, such as the loss or gain of genetic material. These abnormalities occur during a person's lifetime, and are found only in the DNA of cancerous cells. Abnormalities have been found on most chromosomes, but some regions are more commonly affected than others. People with this condition tend to have additions of DNA in regions of chromosomes 7 and 17, or loss of DNA from regions of chromosomes 9 and 10. It is unclear whether these genetic changes play a role in mycosis fungoides, although the tendency to acquire chromosome abnormalities, chromosomal instability, is a feature of many cancers. It can lead to genetic changes that allow cells to grow and divide uncontrollably. Other research suggests that certain variants of LA class II genes are associated with mycosis fungoides. LA genes help the immune system distinguish the body's own proteins from proteins made by foreign invaders, such as viruses and bacteria. Each LA gene has many different normal variations, allowing each person's immune system to react to a wide range of foreign proteins. The specific variants are inherited through families. Certain variations of LA genes may affect the risk of developing mycosis fungoides, or may impact progression of the disorder. It is possible that other factors, such as environmental exposure or certain bacterial or viral infections, are involved in the development of mycosis fungoides. However, the influence of genetic and environmental factors on the development of this complex disorder remains unclear.
Can mycosis fungoides be cured?
Mycosis fungoides is rarely cured, but some people stay in remission for a long time. In early stages, it's often treated with medicines or therapies that target just your skin. Your doctor may use more than one approach.
Okay, pros and cons. It is the most common type of cutaneous T, the cells, lymphoma, and chronic malignant diseases initially affect the skin. Uses application in Ecuador. Total skin reaction with electrode T XI is one of the main therapeutic indications in mycosis fungoid, and this is an effective control with this reduction technique. Is in counting of reaction the entry skin using beam of electron. The weight belong is the phoenix in this technique be the enteric skin safari from the epidermis to the dermis approximately 5 nm.
The title of my study is Second Malignancies in Mycosis Fungoides. In this study, we used two methods. First, we looked at a cohort of patients at the University of Minnesota, 172 patients with Mycosis fungoides seen between 2005 and 2017. And second, we looked at a cohort of patients in the population-based SEER database from the NCI, where we had 6,742 patients. We found of the patients at the University of Minnesota cohort, of the 172 patients, 24 developed a second malignancy. This was compared to a control population of patients with seborrheic dermatitis, 3 of whom developed a second malignancy. We found that patients with tumor stage disease and with advanced stage disease, meaning stages 2B or higher, were at increased risk of developing a second malignancy. In the SEER cohort, we were able to more accurately calculate risks of individual malignancies. We found that patients were overall 10 times more likely to develop a second hematologic or solid malignancy overall. In terms of risk of solid malignancies, patients were 7 times more likely, and for hematologic malignancies, they were 47 times more likely. We found that patients have an increased risk of developing a second malignancy during the first 6 months after diagnosis and between years 12 and 15 after diagnosis, although there is a statistically significant increase along the entire time period. And we found that patients aged 30 to 50 are at dramatically increased risk of developing a second malignancy, although patients across the age spectrum were at increased risk. The most common second malignancies that we saw were lung and bronchus, non-Hodgkin's lymphoma, nodal and extranodal, melanoma, colon and rectal cancer, female breast, and prostate cancer. And the reason we think patients are experiencing increased risk of cancers is we believe that this may be due to immune suppression secondary to the Mycosis fungoides, although further studies need to be performed to really determine if that's accurate.
Okay, in conclusion, as in nursing student is important to know the sign and symptoms and treatment of the pathology in order to assisting the patient is a professional and why. Thank you.